Greetings. I'm Dr. Karl Nath, and I'm so delighted to welcome you to our series, Interviews with Pioneers and Legends in Medicine. I am especially honored to introduce our featured guest, Dr. Donald A. Schultz. Dr. Schultz is an emeritus staff and professor of medicine at Mayo Clinic, who began his illustrious career at this institution in 1949 as a Mayo Foundation Fellow. Dr. Schultz was board certified in internal medicine and endocrinology. His subspecialty interests and research were in the fields of hypoparathyroidism and metabolic bone disease, wherein he established himself as a leading expert at Mayo Clinic. In his career, Dr. Schultz has received numerous awards, including the American Medical Association Physician Recognition Award, the American College of Physicians Laureate Award, and the Teacher of the Year Award in Endocrinology. Dr. Schultz was widely recognized and applauded for the totality of his expertise in and his profound dedication to patient care. In retirement, Dr. Schultz is as active as during his career, with vast and diverse interests and activities outside medicine, including photography, gardening, the Audubon Society, the Performing Arts, diverse volunteer community service, to name just a few. Next April, Dr. Schultz will celebrate his 97th birthday. Dr. Schultz, my warmest welcome. Give us this interview with you.
Thank you for inviting me, Carl. Most appreciative.
I wonder if I may begin to your early training, where you received your BSc degree in 1943 and your MD degree in 1945. Could you reflect with us on your decision and your desire to go to medical school, and how difficult was it to gain acceptance to medical school, especially during those years of World War II?
Well, I was born in Cleveland, Ohio in 1921. In 1932, right when the bad depression began, the worst we've ever had in America, my father elected to buy a small farm 20 miles south of Cleveland. He always wanted it. So we moved out of their relatively new home out to this old farmhouse. But looking back, it was the best thing that ever happened to me. I began to look around, and I saw the world of nature around me that I had not seen in the city. It just wasn't part of me. Well, I looked about me at that time, and I said, you know, what can I do with my own life? I said, I don't want to be a farmer. And I said, what makes this community click so beautifully in the township? And I said, the doctor, the minister at church, and the lawyer, who are held in esteem by people around, who are the ones that really help a person when they needed help. And I thought I should look into this as potential possibilities. Well, it happened to Doc Cuttershaw happened to come down one time, and I had an ear infection. He took care of me. He did it so nicely. No antibiotics, then punctured the eardrum, put hot packs. But the way he treated me and all told me, I said, I wonder if I should consider going into medicine. And so that's how I planted the seed to do that as well. Well, what I did was I was enrolled at Delbert College. I had some help from our school principal and the English teacher. I had to have advanced math and Latin in order to just apply. So they took me at evenings. I would go up 2 nights a week and have my classes there so I could apply to school. I applied and got in. I got a partial scholarship to help pay my tuition.
Yeah.
So I started at Western Reserve in 1939. And then I was lucky. I took my MedCats and then had an interview with the dean, and he thought sure they're probably going to accept me, but he said we have to put these all together, we'll get back to you. They got back to me about 2 or 3 weeks before Pearl Harbor. And when I got to med school, they had to report some things about some patients we'd seen. I went to the library, and I was always impressed when I got some of the review articles. There was something from Mayo. If it was an excellent review.
Yeah.
And I was so impressed with some of those reviews, and I said, I've got to look into this place. Well, I didn't know. Well, it happened a few months later. A Mayo-trained fellow came down to Cleveland to work, gastroenterologist, and he came over to Cleveland City. I was so impressed by him, his bedside manner, the way he questioned the patient, his astute approach to it, and the differential diagnosis. And he just made everyone feel so wonderful being around that patient.
A lot was happening at Mayo at the time in terms of Kendall and Hench working on a series of observations, both clinical and experimental, that culminated in 1950 with the award of the Nobel Prize to Kendall and Hench. Could you share with us memories that you, on any aspect of it, either before, at the time of the Nobel Prize, or after?
I was at Cleveland City Hospital there, my internship then, in 49, and they presented somewhere in the East Coast at one of the meetings, and a movie was made. And we were asked to come. We were going to have a special staff meeting to present the highlights of this meeting and what it might mean for the future. And they had the movie that they made of the patient who got steroids, couldn't get out of bed and get around. I think it was a woman. And that's how the first time I learned about it was at Cleveland City in the movie presentation. When I got here, of course, Kendall retired 2 years later. I only got to say hello to him once or twice. But I knew Phil Hench really well. He was a consultant who would come up, see our patients, and I was in reverence to hear this Nobel Prize winning doctor. He's up seeing a patient for me and telling me what I missed about this patient's problem, and why it was such and such a rheumatologic problem and not another. And it was just unbelievable to have him thank for calling him and seeing my patient and walk out of the door. That was my intro to Mayo, when Phil Hench went in and out of my office door.
Yeah, that's incredible. I'm told that, and I read somewhere, that he was an incredibly astute clinician. Indeed, the proximal observation he made that led ultimately to cortisone was a recognition that patients with rheumatoid arthritis, when they became pregnant, their symptoms abated.
Eddie Reinierson, Dr. Reinierson, who lived right below where you do, he was a good friend of Phil's. They'd known each other in Philadelphia, Pittsburgh. Their families had known each other. And he told me about this and how Phil was a type of person and very astute and very observant. And he said he told me about the jaundice and the pregnancy. So they went to Hans Selye's work up in Canada. He was the man that put the stress syndrome out, and he stressed the animals and showed the adrenals got large, and they were working on it. And Hench Kendall already had isolated in the cortisone, hydrocortisone, and that's how they worked that out.
What was there a noticeable impact at Mayo after two of its faculty members received the Nobel Prize? Was there a sense that the institution had developed a certain stature that was acquired or achieved with the Nobel Prize?
One, having not been here to know before, but I can assure you one thing, that when you were here in your fellowship and all, it was just superb to come to work. You just knew this organization. They were going all out, and they were going out for Super Bowls. There were no Super Bowls then. We wanted to put Mayo super even higher than it was. And you came to work and you had a feeling, everybody, the desk attendants, the gals, everybody behind the scenes, we were proud to be part of Mayo.
And so is it because of that and the commitment to providing that quality care, was that one of the reasons why you stayed, you never left Mayo after your fellowship, and indeed you stayed here for 40 years?
Oh, there's a twisted turn here that's amazing. I had worked in endocrinology as a fellow, and knew the men real well at our church through Bob McConaughey, Bob Salasso and Bill McConaughey. But I finished my fellowship and no one had offered me a job. And so I had lined up various places in the Northwest United States. I thought a great place for my out-of-door living, photography and all, to go there. My mother came up from the farmhouse and take care of our two kids. We lived in one of the 98 Quonset huts. There were 25 by 50 feet basement size behind Hy-Vee South. And we were all set to go. I packed up my station wagon. So I came back before Georgie did. And I was just downtown walking over where the Congregational Church was by the Hilton building now. And I'm walking, Eddie Reinierson walked by. He said, "Hi Don, how you doing?" So Chad and I kind of told him, he said, "You know Don, we were talking last week, we'd like to get someone to come up this summer and work on the floor the rest of the summer, and work on the floor just seeing patients. It'll pray us up to do some other things. He said, would you be interested? And accepted the invitation to be assistant to staff. So I had 9 months as assistant to staff, going to neurology and others, and then I was accepted on staff in April of 1953.
It's amazing how in life the direction one life follows is driven by improbable and unanticipated.
What prompted me to happen to be there that noon, walking past the congregational with Eddie, we were waiting in the street corner for the light to change.
Yeah, it's quite amazing.
Yeah.
In your career, Dr. Schultz, both in internal medicine and endocrinology, you have seen tremendous advances and progress in so many things. Either then or in retrospect, are there things in particular that strike you as truly paradigm shifting or truly a quantum leap in terms of how we either diagnose disease or treat patients? I could think, for example, in your own subspecialty, diabetes, the progress in diabetes is just unbelievable. What are the things that have impressed you either then or looking back now in terms of the practice of medicine?
Well, the simple thing in the old days, we had to check the sugar in the urine by boiling Benedict tablet. Yeah. We had to put 10 drops of urine on top of the tablet with some water and Bunsen burner, and check to see how much sugar was in the urine with a comparative chart. Yeah. And we had to come in Friday night, Saturday, and Sunday and do all the urines. They wouldn't hire anybody for a lab because we didn't have support Medicare and such those days. So when he got test tape and things like that was a big asset, and then being able to check the fingertip with a similar paper was a big move. Benefits, simple but big one. And then I got out of diabetes at that time with George Molinar and service coming in. But I think one of the biggest things was a radioimmunoassay that was developed, and it was just tremendous. Unfortunately, I got a little bit of block on his name. Saul Burson. He's sitting back in the car going home after a day working idea out of radioimmunoassay. Well, he came here, Dr. Ray Keating got involved in getting him involved in thyroid studies, TSH and all. Burson came and day ahead, and we had a nice little dinner for him, and Dr. Ryerson said, Don, Dr. Burson would like to know where Ray Keating's office was. That's unusual. He said, would you take him up and show him about? So I took him up and walked in, and he looked around. He said, I've reached Mount Olympus top. I said, what do you mean, Dr. Burson? I don't understand it. He said, I wrote a paper on iodine kinetics that I passed through, and it was rejected, but only one of the people who refereed it all, checked it, wrote some things along the side. If you'd have done this and this and this, maybe it would have led to this, and this other step would possibly come up with your answer. He said, there's only one man in America who would have done that for me, was Dr. Ray Keating at Mayo. And he said, he put the invigorated me. I went back to work, would yell, and we developed the radioimmunoassay. So, I mean, here this man just so big wanted to be Ray Keating. He did this simple thing, looking over that paper, rejecting it, but gave him some great ideas.
Yeah, that's amazing.
I just have to give you that history because I stood there thinking, and later, see, Burson died then, unfortunately, with a heart attack, but they gave the Nobel Prize to Yellow.
Yeah, Rosalind Yellow. Yeah, and she was awarded the
Nobel Prize.
That's an interesting story. What's interesting as well, I think, Kendall actually crystallized thyroid hormone in 1914.
Yeah, 1914 was the thyroxine.
And it's little recognized that, in fact, not only was he pivotal in the chemistry leading up to cortisone, but he actually crystallized for the first time thyroxine in 1914, and that accomplishment always gets very little, never gets the recognition that it merits.
Well, look at cortisone, 34.
Yeah.
Now look at how long it took before that got sucked his teeth in. All those tons of adrenals that they hauled from the packing plant at Austin. I forgot the number of tons they estimated of adrenals that he extracted before he came up with answers. But it hadn't been for Hinch, wondering
Yeah,
whether something was made by the adrenal, so they
Yeah.
thought they'd try the substance that Kendall done. And that's and they didn't take out a patent on it or anything else.
Your interest in endocrinology is largely on parathyroid disease and metabolic bone disease. How did you get interested in that area? Did you have a mentor who?
Well, I've got a mentor only, Ray Keating. Well, we had two sections in endo for a long time, made a third section of the whole unit, and gave it to Ray Keating. He went to Cliff Guest, asked Cliff to join him, and he amazed the heck out of me. Ray came to me and asked me if I'd join him, and I had no research background, and I couldn't keep up with that. His mind was way out there ahead of everything. And we had a long chat, and he said, Don, he said, I'd love to have you on the floor. And he said, I'll be around a little bit more. I won't spend so much time in the lab so that I got on that section, see, at that time.
Yeah.
Well, Ray Keating then went off to Mass General, and Sam Haynes knew the people there. He had trained in Mass General, and he knew the thyroid people there, and they had the radioactive iodine. Ray went off east and got involved and brought that back. But at the time, he went to every lecture by Fuller Albright, that renowned endocrinologist. And he was a really hot dog in calcium metabolism and had perfected a better chemical measurement than anywhere else in the world.
Yeah.
And he told Ray what we were doing wrong, how we could tighten up, because we weren't seeing many hyperparathyroids.
Yeah.
Ray came back with all the information, put it in a vote. Boy, we went up like this. There's an article by Keating and Cook with Fuller Albright and Ray Keating's visit out east.
Yeah.
So that to me was such a big thing. Then of course along came the scanning. Today, my goodness, the old days people would come here, they'd been explored, they didn't find a tumor, and the poor surgeons here, Ollie Beers, Martin Black, Ed Judd, they had to go through all that scar tissue, carefully dissecting to hope to find that little tumor that big sitting in the middle of scar tissue. Today, the scanning material they have, they could before they go to operate, they know where they're likely to find it. These other men spent hours going through that neck to try to find it. And also then Claude Arnault came and developed the assay for the measurement of parathyroid hormone. And see, now, that took us 2 or 3 days before. Now they can do it in 15, 20 minutes. And the person has surgery, I'm told, and they take one tumor out to be sure there aren't more than one tumor involved. They do a PTH value. It should be virtually zilch. And if it's zilch, they know there's not another tumor present, and they don't miss something. That's all. Talk about the big things that I lived with.
In the 50s, when you began your practice as an endocrinologist, insulin was discovered obviously many years before that by Banting and Best. Was insulin readily available for patients in terms of short-acting, long-acting?
Well, when I came in, I seen no problem.
There was absolutely no problem in terms of
we had plenty of regular, and then we had the NPH came up, Neutroprotein, Hagedorn. And in the years that I was involved in it, there was no problem about getting insulin that I knew of. Other thing that's important in our section is with Randall Sprague. Dr. Sprague was a diabetic as a teenager in Chicago. And he was on the verge of death several times when he got infections and all, because his diabetes got out of control. When they discovered the Banting and Best got the way of isolating insulin from the pancreas, Woodyard apparently was the head of physiology or something in one of the hospitals there, and he got the technique. And Randall Sprague said he used to go down to Armour's to bring back pancreases. Woodyard would isolate the insulin and give Randall insulin from that time on. I'm not sure, but I think he was the first one in Chicago, but I'd have to verify that with more study.
On looking at your CV, one of the things that strikes me is that one of your very first papers was in 1952, and it was published in the Proceedings. And at the time, the journal was called The Proceedings of the Staff of the Mayo Clinic. And what I think is notable about that is that it reflects the fact that the Proceedings was initially introduced as a way of physicians at Mayo educating themselves. And it's now grown obviously to a global and international journal. with a readership that's close to 130,000, and making it the third largest. And in many ways it's a reflection on emblematic how Mayo itself and its physician community has grown extraordinarily. What was it like in your time, where the cadre of physician community was obviously much smaller, and where presumably most physicians knew one another?
Well, the thing I loved when I came, and it'll never come back again in the same way. When I started my fellowship, I was in awe of the physicians. I was just amazed at physicians. But then I said, what makes this place really click? I began to look around, and I realized that Will and Charlie were very astute. They surrounded themselves, when they began to expand, with men and women from southern Minnesota, Iowa, Wisconsin, right around, to be on that allied support care. And they picked folks who wanted to be involved in medicine.
You are as active in your retirement as you ever were active in your professional life. I am truly awed by the diversity of interests and activities: photography, gardening, the Audubon Society, the performing arts, diverse volunteer services within the community, and actually being a volunteer for patients at Mayo Clinic. How do you maintain that remarkable freshness, enthusiasm, joyousness in whatever you do, and so much of what you do?
Carl, I won't be able to get my hat on if you talk like that. Don't give me a big head. I enjoy people. I like sharing with people.
Yeah.
We all have our own shortcomings. We have our own foibles. Overlook them and realize this is what life's all about.
Yeah.
And I always had two things I carried with me. One was, in this life, learn to count your blessings, of which we all have many, and not dwell on your misfortunes, of which we all have some.
Yeah.
And the other thing is, always try to bloom where you're planted.
Yeah. Beautiful statement.
Try to be part of that community. Do something, have people know you're there, and then want to work with you, be around you, and enjoy your company.
You know, one of the things that I always find very wonderful to see is when I see you periodically in the Mayo Clinic campus, acting as a volunteer, showing patients where to go, giving them, being available for any questions about where certain clinics are, where certain things are. And I think that element and that character of yours, where you're giving back after having this very distinguished career, is something that's very encouraging. And I think just serving as a volunteer in itself makes a very important statement.
Well, I've enjoyed. See, I was one of the co-founders in '93.
Yeah.
Eleanor Van Roekel, her husband, was a dentist here. She was brought over in the Pink Ladies to get it started. And she said we'd like to show movies for the patients in Judd Hall when they got some free time.
Yeah.
And not Hollywood movies, I'm talking about their biographies and such. And she came to me and I said, you know, they hired me for 2 more years after I retired just to supervise residents, but I got to hang it up one of these times. It'll be 72. I said, sign me on. So we opened up in '93. So I've been with it now for 24 years.
Yeah.
And since it opened, and it's just wonderful. I sit downstairs and have a ball,
and
I learn what's new here and telephone operators make me look good every day in the week. If I don't know the answer, I call up the operator and say, I'm down the welcome desk here at Uganda. Patient asks me this and that, how do I, where are they? Fine, no problem. No problem.
The generation that comes after us going into medical school really represents the future. And I think one of the themes that come out in our conversation is the desire and the capacity to always see the good, to quote Alex Seeley, to find the good and praise it. What advice and guidance would you give to young people who are earnestly interested in pursuing a career in medicine, and to always see that capacity, that ultimately it's a career of service and it's a profession that's dedicated to doing good? What advice or guidance or things that you've accrued from your experience you would advise young people in that way?
I had the answer to that one. They had me in Washington. But no, I was being flip. I mean, it's such a difficult thing, and I see young people going into it, but they're raised in this information technology world. They, can get all, and that's part of the way they live, and they think that's the way it's be and it's going to be. I don't know. They have never tasted the other way of doing it and having the personal relationship close. I don't know how you get that back. They have to want it back. They have to decide what they're doing, and just doing it online and the rest of it is not fulfilling the rewards they need for the output of what they're putting into the patient. I think that's where you get some of your burnout. You're not getting enough satisfaction to balance it out. And you're more and more demands instead of less. There's more of these bureaucracy things, more everything else thrown at you instead of right on the patient.
Any final thoughts or comments for our viewers and for readership?
No. Thank you for inviting me to listen to my palaver.
Dr. Schultz, this truly has been my privilege and my good fortune and my pleasure. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.